Seeing too many people in the wrong Medicare plan, so I wanted to talk about that today. 5 reasons you should definitely check your Medicare plan today, this week, this month, definitely by the end of March. So we'll go into exactly why the timing is so important. This is also a live Q&A. It looks like we ever got a lot of questions. I'll go over the 5 reasons you need to check your Medicare plan, and then I'll open it up for any and all questions on all things Social Security, retirement, disability, survivor benefits, all the rest of it. How can I help you? My name is Ed Weir. I ran the third business Social Security office in the country, and now my semi-retirement. I'm helping make sure everybody gets what they earned, survivor benefits, and all the rest of it, disabilities. So make sure you subscribe, like, share, and all that kind of good stuff. Okay, enough stalling. Let's get right into it and talk about that's not the right graphic here. It's a one-man operation here, so me and my son. Okay, all right. So we're going to check your Medicare plan. Why should you check your Medicare plan? This is the open enrollment period. Medicare Part A and Part B, and the Medicare Advantage and the Medicare Supplements and the Part D, the prescription drug plan. It's just a nightmare in terms of enrollment periods. You've got the open enrollment period and the general enrollment period and special enrollment periods, and you've got a different general enrollment period and a separate enrollment period for a Medicare Advantage versus a Medicare Supplement versus Part A and It's just a nightmare. So you never and unless you have a PhD in Medicare, you can never figure it out, and it's changing all the time. So that's always best to defer to the experts, and that's why I've teamed up with a chapter of Medicare. You can reach out to them, and they can help you out. But all right, so for right now, let's stick to one thing. January, February, and March is called the open enrollment period. So you can change your Medicare Advantage plan. Or you can go back, you can get out of a Medicare Advantage plan and go back to original Medicare and then get a Medicare supplement. So we'll talk about that here in a little bit. So let's go in. So January, February, March. So if you go ahead, this is the end of February here. If you change your Medicare plan or go back or whatever the case may be, then if you get it done today or tomorrow, by the end of the month, then your new plan will take effect March 1st. So that's January, February, March. This is different than the annual enrollment period, which lasts from October 15th to December 7th. And then you have the special enrollment periods if you move, if you have Medicaid, if you lose your health insurance from work, all those different variations. But right now, you can definitely change it. So a lot of people didn't check their plans. And this is the next thing. 2025 has this last annual enrollment period up to December 7th. It was probably one of the most chaotic Medicare seasons in decades because there were so many different changes on Medicare plans for 2025. You had companies leaving the entire state in some states. You had companies saying, well, we're not making any money there, so let's just drop all those plans and let people fend for themselves. And unfortunately, the numbers is about 1.8 million people had their Medicare plans essentially canceled or a lot more downgraded. And unfortunately, we're seeing every single day people going into the doctors or hospitals and saying, handing them their Medicare card they've had for, a year, 2 years, or 3 years. And then the doctor or the frontline people saying, this plan was canceled December 31st. And people didn't get the letter, didn't open the letter, didn't get the email, whatever the case may be. And they're out. But they still have it. Those people still have an opportunity to get another plan. And as I mentioned, there's a lot more. There's about 1.8 million that were canceled, but there was a lot more that were actually downgraded. So last year you might pay $100 for an MRI or $100 a night for a hospital or something, but this year it might be $200 or $300, or you might have lost your grocery card or might have lost your gym membership, whatever the case may be. So it's important, particularly this year, to check your plan for 2025. And if it's still the best plan for you, then you're good until annual enrollment period later on this year when the new 2026 plans come out. Another reason is if you have a Medigap plan, also called the Medicare Supplement plan, like a Plan F, a Plan N, or a Plan G, those are the ones you can actually change any time of the year. So it's good to do it immediately particularly if you're healthy. If you're looking for a cheaper plan, so if you, let's say you have a plan F or a plan G, and you're paying a lot for the monthly premium, any time of the year, 365 days of the year, you can change that to another plan. But yes, you might have to go through health underwriting depending on your state and the particular company and everything. So in order to get a better price, even in the same company, maybe switching to, from a G to another G, or from a G to an N, or from N to a G, you might be able to save some money. And again, you reach out to Chapter and they can help you out and see if there's a better price. If you're switching your Medicare supplement like that, you can't do anything with your prescription drug plan right now. You keep that in force. For most of the time, you can't change that until the annual enrollment period in October. See what I mean about the whole thing being a nightmare in terms of, yeah, anyway. And as I mentioned, you can also change here January, February, March. You can get out of a Medicare Advantage plan. If you don't like it, you're tired of the prior authorizations, you're tired of the networks, you can get out of your Medicare Advantage plan and go back to original Medicare. But again, 51% of people who sign up for Medicare Part A and Part B, they also get a Medicare Advantage plan. And why do they do that? Usually it's because, it's a price issue. It's a premium. A lot of the Medicare Advantage plans only have they have zero premium plans, but it's a pay-as-you-go system. The monthly premium might be zero, but it's a pay-as-you-go system. Medicare supplements, those have a monthly premium, but they're not necessarily pay-as-you-go. A little bit different depending on what your plan, but they do have a monthly premium, but there's no networks, no prior authorizations. So if that works in your budget, I always recommend checking out Medicare supplements, also called Medigap, because they cover the gaps of Medicare. I always recommend checking those out first, and then, if those aren't right for you, then check out Medicare Advantage. But, you always process of elimination to make sure you're getting the right thing. Another reason that people don't get the Medicare supplement is because a lot of times agents, they make more money enrolling you. Go figure. They make more money enrolling you in a zero premium Medicare Advantage plan. And you're like, wait a second, how does that work? I'm actually going to do a video tomorrow. I'm having someone from Chapter appear tomorrow with me to explain, these free plans, A, B, C, D, and all the rest of it. How could they be free, and are they free? And so all the tricks. So we'll talk about that tomorrow. And if you do have a Medicare Advantage and you're going to stay with a Medicare Advantage plan, then you just might be able to find one with, the more options. Again, maybe you didn't check during, the annual enrollment period, October, November, December, or the person that helped you checked, they were an agent rather than a broker. Sometimes those titles are used interchangeably, but always go with a broker, because an agent, a captive agent is what they call it, usually works for one company. So if you go up to them and you say, which company, which plan should I take? Obviously, they're going to say their company's plan. But a broker works for you, and they look at all the plans in your area and they tell you, hey, based on all your needs and everything, this might be the best option, but it's completely your decision. So they work for you rather than the insurance company. So that's all. And all of their help is free, whether they're an agent or a broker or Chapter. They don't charge you anything to help you. So, how does that work? We'll talk about that tomorrow. Exactly, the pay and everything. I'll always follow the money. But yeah, if your doctors, you find out your doctors are no longer covered in your Medicare Advantage plan, or you have a new doctor that you really like, and you want to switch to that plan, or if there's you've recently got Medicaid, then there are other plans available, Medicare Advantage dual eligible plans. If you recently lost Medicaid, you'll need to switch to a regular Medicare Advantage plan. So there's so many different variations. Remember, all this stuff you paid for, all those decades you paid into Medicare, that's where all the money comes from. Super long story short, we're to get into more of the details tomorrow. Okay, so those are the 5 reasons you should definitely check your plan as soon as possible. I wanted to make sure we went through those as quickly as possible so we can spend as much time answering your questions on all things, everything. Let's Let's see. Jose, I have a phone appointment for SSI, turning 65 in April. You mean Social Security? SSI is the welfare-based benefit you're probably talking about. Yeah. Already received the Medicare card and planning to talk to CHOP per your recommendation. Can I also apply for SSDI? Yes. If you're under your full retirement age, you can definitely apply for disability and retirement at the same time. You won't get both. You'll get the higher the benefit, whichever, if you're approved for disability. Disability is almost always the higher benefit amount. But this is called Social Security employees call this a rib dib. Basically, because disability takes about 6 to 9 months to get approved, and people just can't wait that long, for 6 to 9 months if they're lucky to get their disability approved. So because of that, they file for early retirement to get those checks started and able to pay their rent and mortgage and food and stuff like that while they're waiting for their disability claim to be approved. So yeah, you can. So you've got your appointment in April for regular retirement benefits. You got your Medicare card, and at that time, yeah, tell them I would also like to file for disability. I'm disabled. My disability is going to last 12 months or longer, and I can't work because of it. Absolutely. Let's see. Got a question. What are the supposed changes that Elon and Donald Trump have for SSDI? Will it affect child benefits? They have cerebral palsy. Thank you for taking the time to read and answer. Hey, Blake, I am going to be doing a video on that probably tomorrow or the next day. I'm going to spend a lot of time. Yeah, it's disability is going to be, in the crosshairs. SSI, SSDI, Medicaid. I'll do another video on that probably today, although a shorter one. But it's crazy times. Hello, writing in for my sister. Awesome. We like people helping out other people. Filed for Social Security retirement benefits on her record. Also, she applied for spouse benefits on her ex-husband's record. They were married 10 years. Spousal denied. The only reason they would be denied, because you did meet the 10 years, is if the ex-husband is not at least 62 years old. If the ex-husband is already receiving benefits or they're at least 62, then that's good. The other reason would be that there's just no more money there in terms of your sister's benefit amount is not less than half of his, because to get benefits, then, you had to be married to the person 10 years. Yep. The other person has to be at least 62 or receiving benefits. If that's good, you're good. And then her benefit amount has to be less than half of his. If that last one, that sounds like it's going to be that last one. Unless she's currently married. If she's currently married, then I guess that one would preclude it as well. Are there some disabilities that are not subject to regular reviews? I am hard of hearing, deaf, one ear, and the other ear is profound. Going forward, I think that's one of the big issues going forward is there are going to be massive continuing disability reviews, and it's going to be a show. Former Marines out there know what I was going to say. It was going to be a something show going forward because they're talking about cutting the staff in half, and I'm going to talk about the continuing disability reviews in the next couple of days. Thank you for all you do. Got an email this afternoon saying my benefit has been reduced due to WEP, and they are recalculating it. Got an email that saying my benefits have been reduced due to WEP. Yeah, no, the WEP law, the Social Security Fairness Act, I just talked about yesterday a bit. So that has been overturned. And they are recalculating it. So, okay, I see. Okay. So the computer system hasn't been fully updated yet. They put in your claim. They should have just, I'm not exactly sure how they're doing it internally. They should just put in the claims path in MCS. They should just put in the application, do you receive a pension, a non-covered pension? And they should just put, I guess they're putting yes in case the law changes in the future. So I guess they're maybe, covering their bases. But anyway, the lawyers and the computer people are working on it now. And once they redo it, then it should be good. What about plan Medicare A, B, C, D? Yeah, I'm going to talk about. Join us tomorrow, and we're going to go through all of the letters. Yeah, Medicare Part A and Part B, you sign up through the Social Security Administration. All the rest of it, you sign up through private companies, agents, brokers, chapter, whoever. Jordan became a silver member. Mara became a silver member. Thank you. Appreciate it. Let's see. Thank you. I am retired with spouse survivor benefits. Do you think that I will be eligible for the check? What check are we talking about? Are we talking about the so-called Doge dividend stimulus check or whatever, that they're returning money once they find money? Yeah, that's not going to be for a year or two or so, if at all. So not sure about that one. SSDI work history reports request jobs going back 5 years from onset date. Yeah, they changed that law just a few months ago. It used to be 10 years, and that was always a nightmare when I used to take disability claims. And it's like, okay, what did you do? 7 years ago? I don't know what I did 7 years. Yeah, so it's nice they abbreviated to make everybody's life easier. If last job was over 5 years ago, will any job on report be treated as previous work experience for disability determination? Yeah, they can only go back 5 years. Yeah, they only ask you about 5 years. So if anything beyond that, then yeah. You mentioned doing a live stream specifically on SSDI this week. Yes, I'm going to be doing that this week. Absolutely. I'll definitely get it to it before Saturday, so within the next few days. They asked for changes in my pension between the 22 and 23. Only changes were CSRS COLA. Do I need to report those? Technically, under the old system, you kind of did CSRS through OPM. A lot of that time, the Social Security Administration, the computer interacts with the OPM for the CSRS. But so for COLAs, you didn't necessarily have to. But now you don't have to at all because of the Social Security Fairness Act. So I would, it's your choice, but I don't think it's not necessary anymore because it's not relevant to anybody anymore until it's relevant again. What's going on with SSDI? I missed that one. Thanks. Yeah, so I'm going to do one on that one. Hope you're doing well tonight. Yes, I certainly hope so. Hopefully I got my voice for the entire time. So hopefully we shall see. All right, let's see. Oh, I love these. My friend, my sister, the little old lady down the street. This is what this channel is all about. Learning the information and then helping those around you. My friend retired at 65, gets $1,600 a month, works $14,500 a year, pension, 100 munchin. She will be penalized for working. Total income minus Social Security. No, she will not be penalized for working. She's 65 years old. She's only making $1,000 or $14,000 a year, so she's good. They don't count the Social Security and they don't count the pension. They only count work, earned income or net income from business. So her earned income is $14,000, and that's way under the annual earnings limit, which is the $23,400. So no penalty whatsoever. Worried about Medicaid after the budget vote last night. Yes, that is. I'm going to make a little video here in a little bit and a short one, 5 or 6, 7 minutes or so, and update what's going on. I see some conflicting information out there, so I want to kind of set the record straight. Concerning SSDI grid rules and previous work history, when does the 5-year look back begin? Onset. Yep, whenever you say your onset began. Hello, good evening. I was wondering when you were going to do the rules while working on SSDI like you've done for the seniors that collect retirement. Yeah, I'm going to be doing that same time. But I've also done, I've done that a few times as well. I've done over 1,000 videos. So, but there's always, so much out there. Hey, Harry, married to a Filipino. How many years does she have to be living in the USA and married to collect spousal benefits when she's 62 or spousal? Each country is a little bit different. As I mentioned before, you really need to call the Federal Benefits Unit and ask them about the totalization agreement between the United States and the Philippines specifically. Off the top of my head, 5 years or something like that. The guy that was in charge of the Federal Benefits Unit, Jason, he's transferred out of there starting April. He's back in California. There's a new person over there, yeah, each country is different. So I would definitely reach out to them and find out exactly what that particular totalization agreement, talks about with specific Philippine cases. the totalization agreement, because they're all different. Just signed up today for Plan G. I know you don't like specific companies mentioned in place advantage. Okay, yeah, I try to not mention companies. But yeah, so yeah, you did the right thing. Medicare Plan G, your budget afforded it. And again, when I say about budget, it if if you have a crystal ball and if you're able to look in the future and say, hey, I'm going to live the next 50 years and I'm not going to be, I'm not going to be sick or injured and everything is to be cool and copacetic and I'm not going to be using health insurance really. So, and just one day I'm going to, die skydiving or, falling off a rock at Acapulco or whatever the case may be. But I'm not going to really need healthcare. Then if you're able to know that, Medicare Advantage all day long, 100% recommend Medicare Advantage. Zero premium. Why pay a premium for the next 50 years if you're not going to use it? But because we don't know, you say, okay, well, Plan G, it might be $80 a month or $100, $150 a month. And you're like, wow, but a Medicare Advantage is zero. But if something happens, then you got to go prior authorizations and the doctors and, $100 for this and $200 for that and $100 for this other thing and $50 for this other thing. And then, it limited networks and you got to jump through these hoops. And you're like, I should have planned, I should have just doled out the money on a monthly basis. So yeah, and people that get like really serious terminal type, terrible cancer or something like that. Yeah, anybody that's ever gotten like a Plan G or like, oh, I'm so glad I, doled out the extra money and got a Plan G. But if we had a crystal ball, everybody would get Medicare Advantage if the crystal ball said they're going to be healthy for the next 50 years. All right, let's see here. Okay, I already answered that one. I was on SSDI as a widow. Now I retire because of age. Can I switch to a supplement as I'm on an Advantage plan? You can. Pretty much anytime you can try it if you're healthy, but you're on SSDI before, so your previous health type stuff might preclude you from passing the health underwriting, but it really depends on your state and everything. It doesn't hurt to try. But if you're turning 65, then no health underwriting. You can apply for any Medicare supplement plan you want that's available, N, G, maybe F if you're very aged. But yeah, no health underwriting. It depends on your particular state. Well, if you're 65, there's no health underwriting, period. They can't deny you. They can't charge you extra. So you have that time, those few months before and after you're 65 to get it done. So yes. All right, let's see. Social Security disability denied. Appeal. Same thing when if you have a Medicare Advantage and whatever procedure the doctor recommends is denied, appeal. For Social Security disability denial, you file the SSA 561. It's the request for reconsideration. You submit that, and yeah, if you've already done that second level, then it goes to the administrative law judge. So, yes. When can one change Plan D, the Part D, Medicare Part D? It's usually during the annual enrollment period, October 15th to December 7th. But there's, exceptions and stuff if you move and everything. So it might be reach out to chapter and they might be able to help you out. Can you explain how pre-existing conditions? America is basically the only one that has this thing called pre-existing conditions. Every other country calls it your health history, but in America, it's, because health insurance companies have used that term to deny people's health care. Oh, you have pre-existing conditions. It's like everybody does, one phase or another. But yeah, and that's what the Affordable Care Act, Marketplace Insurance, Obamacare, whatever you call it, that ended that for that. But for Medicare supplements, there still are, they can deny you for health reasons. Medicare Advantage cannot deny you. Medicare Part A cannot deny you. Medicare Part B cannot deny you. Medicare Part D, the prescription drug plan, cannot deny you. And the only is Medicare supplements, but depending on the state. Okay. Can you explain how pre-existing conditions affect open Medicare enrollment periods access to Medicare plans? Has it changed with the new administration? Nope. So no changes yet, but I am keeping up on it. Dr. Weir, two callers on Tom Hartman today said a fat envelope from traditional Medicare arrived today and they may owe $900 for their normal $20 payment. We're told to contact. Yeah, there are just so much Medicare garbage coming out, particularly when you turn 65. When you turn 65, every health insurance company, a Medicare insurance company, a Medicare insurance agent and broker in the country wants to take you to the 65-year-old prom. It's like you're, king and queen of the prom back in high school. They all want to take you to it because they make more money when they sign you up the first time for those Medicare Advantage. They make like double than if you signed up for a plan at 67, 80 or whatever like that, or if you're not new to Medicare, they usually get paid double for a Medicare Advantage. So that's why when you're 65, you're just inundated with junk calls, and they're not supposed to be calling you. That's, unless you reach out to someone and said, call me, they're not supposed to be calling you, but a lot of unethical people out there. That's why I joined up with Chapter, because if you don't call them, they ain't calling you. And and that's exactly how it should go. Does SSDI, SSA add to the federal deficit? No, it does not. If not, why is Doge investing? Yeah, Social Security does not add one penny to the deficit. The $36-37 trillion of deficit debt. Deficit is the yearly thing. The debt is, $36-37 trillion, but it does not add to it at all. It does not add one penny to it. We have loaned. We've put our trust fund in to regular government treasury bonds and stuff. So part of that debt that's money the government owes us to pay back our Social Security, what we saved. So when they pay that back, that's going to increase their debt, but it has nothing to do with Social Security. That's like if you loan money to your nephew, and then after a week later, he says, "Hey, give me that $1,000 back I loaned you." They say, "Well, that's going to put me more in debt. I'm going to have to borrow from somebody else." Well, sounds like a personal problem. You still owe me $1,000. You said you'd pay me this week. So, Doc, it was fantastic to talk to Chapter today. No need to call the insurance company. They are awesome. Good deal. Yes. All right. Good deal. I like it. So that's why I chose them. Because remember, Stacy, they're one of the few outfits out there that do the after service. It's called the Member Success Team, and I've had the one of the supervisors that controls that team, that supervises that team. And so if you have any problems, you need to find a new doctor, you get this weird bill, you've got any other issues with that plan going forward, give them a call, and they can help you out. Most other companies, it's like they sign you up and they forget about you. So, does open enrollment include retired federal workers? Yes. Yeah. It just includes anybody. If you're looking for a Medicare plan or something like that. Yeah. But if you're a retired federal worker and you've got, FEHB, the Federal Employee Health Benefits, you definitely don't need a Medicare Supplement plan. Do not get a Medicare Supplement plan in your particular case because, you're already paying for Federal Employee Health Benefits. So there's no use in paying for Medicare supplements because it's just double coverage. Some get a Medicare Advantage plan because they want the extra some bells and whistles if there's one available in your area, but you don't really need that either. But in terms of if you have FEHB, you get Part A, you might not even need Part B, but I'd reach out to OPM or whoever your agency is if they're still open. Yeah. My sister hired lawyer by mistake in 2023. 25% or $7,200 is their fee to do what's lowest or max amount. Yes. They take 25% of your back pay up to now it's $9,200. And regular viewers to my channel know that if you want to get a lawyer, get a lawyer. I try to avoid saying bad things about lawyers because they're lawyers. If you want to get a lawyer, get a lawyer. But for the initial claim, why waste the money? The application or the Social Security employee will ask you the same exact questions as the lawyer and fill out the application, send it in. The second step, the reconsideration, takes 5 minutes to fill that out. The third step, when you have to go see an administrative law judge, yeah, that's when I'd probably get a lawyer. And you see them play around with the numbers of, if you use a lawyer, you have a 50% better chance of being approved. call a lawyer sometime and ask them, hey, I want to file for disability. They will ask you some questions. And those questions are screening questions to see if you're even possibility of being approved. So they selectively choose ones they think they're going to make some money on. And of course, they have a higher approval rate because those are the ones they choose. Yeah. It's like in Japan, the police force 99% convictions on criminals. It's because they know it's not a slam dunk. They're not going to do it. Yeah, so it's selective. My local Social Security office is offering a phone appointment for SSDI application. Is this okay? Yeah, that's fine. Yep, I've done hundreds of thousands of phone appointments on disability. You can, you can do it on. You can demand. You should be able to demand an in-office, face-to-face if you want. You can do it online, but yeah, either one of those is fine. So make sure you get all the information. I've got a few videos on tricks and tips on filing for disability. Make sure you got all your prescriptions, your doctors, when you saw them, what you saw them for, all the rest of it. You don't need to get the documentation, the medical records. You just tell Social Security and you fill out a form, usually list a verbal attestation, an SS 827 authorization to release medical information, and then Social Security gets the medical records directly from wherever. So my plan supplements available in my county. My last MRI was over 500. Wow. You sounds like if you paid 500, then that means you have a Medicare Advantage plan. If you had a Medicare Supplement plan, you would pay, the yearly deductible, and that's pretty much it. So if you have a Medicare Supplement plan and you have $1 million, like if you have a Medicare Supplement Plan G, and you have $1 million of a chemotherapy or whatever the case may be, you pay this year it's $257, and the other $999,000 whatever pays. It's paid by Medicare or the Medicare Supplement plan. I pop-up just said Social Security is providing a small burial plan. $255. Very small. Going back, it's been around the same for decades. I've issued hundreds of thousands of those, and nobody was excited, rightly so. But that's why because I've seen it firsthand of a lot of people, passing away and they don't leave anything. So if you've got, $10,000, $15,000 left over in your bank account in case something happens to you that covers the burial and, leftover healthcare costs and, any type of debt or anything like that, you've got that covered, then you don't really need burial insurance. But for those that don't, you can call that number there. And I've vetted these guys. They're good. They're not going to give you the hard pressure sales like a lot of those companies do. And they'll help you out and find out what's good for you. And if they give you a hard time, let me know, and then I will part ways. I have a great Medicare Supplement plan. Medico. Oh, okay. Perfect. Yep. Yeah. There's in each area, if you say I want a G or an N, then, there's probably a dozen or so that are available in your area. If my sister filed for SSDI in September 23, she has been awarded. Does it back pay till September 23? Do they take differences from what SSI and SSDI? A lot of questions. Or do they give back pay to SSDI to the date? Does she keep? Wow, there's a lot of questions there. Okay, so yeah, if they determined she was disabled back in September 2023, then they will backdate it. But remember, there's a 5-month waiting period. Social Security disability, there's always a 5-month waiting period. If she has been receiving SSI, kind of temporary SSI, supplemental security income, then they will offset that. So if you were getting, $900 of SSI and then you're approved and your SSDI is, $1,000, then they'll say, hey, we already gave you a 900. So here's the extra 100 going back to whenever. So Mary Jo Poole, it confuses me because I thought Medicare and Medicaid Part A and B, you were okay and didn't have to use like another company or something else for extras. I'm lost. Yeah, the whole thing is just way too confusing. I agree. So if you have Medicare and Medicaid, and you have, Medicare Part A and Part B and Medicaid through the state, it's the welfare-based program, then you should be good. You Medicaid probably already has you signed up for a Part D plan, so you have that as well, the prescription drug plan. But a lot of people who have Medicare and Medicaid, because you're now dual eligible, you have Medicare and Medicaid, are eligible for what's called a Medicare Advantage dual eligible plan. And those are usually good depending on, your particular area. Those are the ones that got all the bells and whistles and grocery cards and free transportation and all that kind of stuff. But you have to have the higher levels of Medicaid. So yeah, check it out and see if it's right for you. But you don't necessarily need it. But a lot of people, yeah, because they're like, hey, extra money. And remember, you paid for all that. This is money that you paid for when all those decades you paid into Medicare. That's where these companies are getting that money to give you all those benefits. So it's basically your money. So go get it. Let's see here. Question. I'm 59 and a half. I called Social Security 2 times about plan N and G. Got 2 different answers. I got to be 65 eligible, but higher premiums. Can you explain? Yeah. Social Security knows nothing about Medicare plan N and G. So if you called them about N and G, they will, what are you talking about? Yeah, those are private companies. So that's why you probably got different answers. If for N and G, you have to have Medicare. So if you don't have Medicare, you can't get a Medicare supplement because there's nothing to supplement because you got to have Medicare. So, but if you have Medicare because you were on disability, under 65, then you can get a Medicare supplement. But in most states, the state doesn't require insurance companies to provide Medicare supplements to most people. They can't say anything about when you turn 65, everybody in the country can get a Medicare supplement. But under 65, the insurance companies know that, well, the reason you have Medicare under 65 is because you're disabled, and that's a lot of money. That's going to cost a lot of money. So they convince your state. This is not a federal thing; it's a state thing. That's why some states they do, New York and California and different. And so you might not be able to get it under 65. So because you can't pass the work history, or they just don't offer it. The health underwriting. Okay, I already answered that one. Let's see. After being turned down 2 times in 2019, 2021 for SSDI, my son was awarded back pay for 3 years. Owed 1 year, no response from our emails to U.S. Rep in Michigan. Yeah. So you need to pick another representative, pick another senator. And so I guess, that is a congressional that those are put on the front of the list. So reach out and say, hey, find another person to have them expedite your case. So, but at least the Social Security Administration, what happens is when you do a congressional like that, you send it to whatever, federal congressperson, senator, House of Representatives, and they forward it on to Social Security. It goes from Baltimore to the regional office, to the area office, and, to the district office, your particular district office. And the manager is supposed to respond like within 24 to 48 hours. And so part of the response is, yes, we called him, Lori's son, or her, because she's the representative payee. We called her, talked to her, told her this, that, the other. We're working on it, whatever the case may be. So if they haven't even done that, then I think your congressional request never got anywhere. So I pick another rep. I am 60 on SSDI. I have a 10-year-old that I get money for under my SSDI, which is half my SSDI. Right, correct. Which I reach retirement. When I reach retirement age, will I get money from my daughter? If so, the pay same. Okay, it's not. It won't change. It's the same thing. So if you have a 10-year-old and you're receiving SSDI, when you reach your full retirement age, it doesn't matter. Nothing will change. She'll continue to get 50% of your benefit amount. Let's see. Understood. I would call chapter because sometimes it's better just to be under regular Medicare. Yeah. If you got it in your budget to pay for the monthly premium for a Medicare supplement plan, then yes, that's the way to do it. That way you don't have to go through the hoops of prior authorizations and networks and all this stuff. But unfortunately, a lot of people just can't afford that monthly premium. Chapter is wonderful. Okay, good deal. I called them and they advised that I'm not going to mention companies, would be good for my needs, even though I was happy with the other company. I switched because of the difference in the hospitalization cost. Yeah, that's so it looks like that's a hospitalization cost. That means it's a Medicare Advantage plan. And, maybe this year it's Keystone, so it's probably Pennsylvania. So this year, that one might be the best one. And then next year, they compete. That's the thing about, you've got all these different companies, and every year they try to outcompete each other by getting, hey, we'll, give you $50 a night for hospital. And this one was like $100. And the next year that one, oh yeah, we lost a lot of people last year because ours were $100. So this year we'll do $25. So with a Medicare Advantage, you can save money, but you have to work for it once a year. So with the Medicare supplement, once you're on a Medicare supplement, then the only variable is how much your monthly premium is. Everything else is the same. Is having a police pension $4,500 a month and $385 Social Security. I paid in Social Security 20 years before becoming a police officer. Also, I paid Social Security during 25 years as a police officer. Will I get an increase in Social Security? I'm 76 years old. Yeah, it sounds like based on your monthly benefit amount of $385, you are being wept. The windfall elimination provision, and you worked at some other place that didn't pay into Social Security. So, yeah, it definitely sounds like you are one of those people, the 3.2 million people that are going to get their benefits adjusted because of the Social Security Fairness Act. Make sure you reach out to Social Security. I'm sure they have all your address and phone number and everything updated, but it doesn't hurt to reach out to them and say, hey, I'm still here. Here's my address. You got my right phone number in case they got any questions. My sister, she didn't know she talking to a private lawyer. She thought they were Social Security. Found out I had them removed off. I did all the paperwork for SSA. She was awarded, and now law pet forfeit. Okay. So you can, if you hire a lawyer, and then, before your case is decided, you decide you no longer want that lawyer, then you can remove them. Sometimes they will request a fee, even though, if they did half the work, if they, were, had a whole bunch of expenses or whatever like that while they work on your case, sometimes they will appeal to Social Security and say, hey, this person has removed me as their representative. I'm no longer their lawyer, but, we did a lot of work, and so we deserve, X amount of benefits if that person is approved. So, Trump said today he was not going to touch Social Security or Medicare. Okay. But it needs to be touched, or we are going to get cuts in the next few years. So in 2034, 2033, we're going to get 21, 22% cuts, and possibly more if some of the things pass over the next month or two. Or we can choose to have zero cuts by actually touching it. If we say, hey, we're not going to do anything, that means we're just going to sit there and watch the house burn down. And I don't think that is a good option. So it needs to be fixed. They just can't keep calling the, kicking the can down the road. Please tell me about the Fairness Act, and will my little $500 retirement check be increased? My full retirement is September. Thanks for all your help and information. So yeah, if you worked in non-covered employment, you worked at a state, city, local, even a long time ago in the federal government, you didn't pay into Social Security, then you were subject to the windfall elimination provision that adjusted your benefits. And if now, none of that matters because it has been repealed. Let's see. Just remember, Project 2025 is a plan to get rid of all Social Security all social programs to help working claim. Yeah. And people say, oh, it's not part of it, but yeah, the guy that wrote is in charge of the Office of Management and Budget. So guess what? Project 2025 is, I think they've seen close to 50% have already been implemented. Why didn't Biden restore the Social Security staff? He expanded government employment in most other agencies. Yeah, I agree. He really should have. He'd use the reconciliation process to increase, to help the IRS so they could go after, the real money, the super wealthy that are able to, hide their money through, super, good tax lawyers and accountants. Well, we can't. So now when they cut back the IRS staff, it's like we can just go for the low hanging fruit, regular people. Because we don't have enough staff. We need an army of staff to go after the rich people because they've got, an army 5 times bigger than ours, but now they're just going to go after us. So yeah, I agree. He should have used the reconciliation process to increase staff of Social Security, but um, yeah, and now it looks as though staff is going to they're talking about a massive cut to staff, and this has been happening about for decades. Under the previous Trump administration, staff was cut. I mean, it's it's terrible. I started getting Social Security and disability after I had a stroke in 2014. I'm getting a percent of my Social Security now. I'm turning 62 in March, but I don't want to get my full amount until I'm 65. So yeah, if you're getting disability benefits, you're already getting your full amount. So you don't have to do anything. Yeah, you're turning 62. So if you file at 62, you're going to get a 30% reduction. If you wait until 65, you get a reduction. If you stop disability and go on retirement. But if you just say on disability, you're getting the full benefit amount. So yeah, you don't have to do anything. I have a question in reference to the Fairness Act. Do you have to have 40 quarters in order to receive the money for the Fairness Act? Yes, in order to get Social Security benefits, period, you have to have paid into Social Security. So the people that are in that Social Security Fairness Act, they did pay into Social Security. They just worked other jobs that didn't pay into it. And that's why it's calculated like that. So MF became a silver member. Thank you very much. I get your recommendation of selecting a supplement plan with Medicare. I am eligible for TRICARE for life. Do you consider this supplement or something? You're good. I wouldn't do anything. So you got Medicare Part A, Part B. You have TRICARE. That's essentially your supplement. Some agents and brokers out there, want to sell you a Medicare Advantage plan. Some very, very few. Chapter really doesn't do that because it's, you're good. You're good. So just keep on keeping on. Thank you for your service. Someone cut the USAID budget that helps to fight Ebola outbreaks, the world's deadliest disease. What a guy. Yeah. And and then he said he found the greatest fraud in U.S. history and in world history, I think it was. All these dead people receiving Social Security benefits over 150 years old. But as I talked about the other day, it's like, okay, why haven't those benefits been stopped? And if they are, we're talking, over close to $400 billion a year that is being paid out to people that are deceased. Why haven't you stopped those benefits? Where'd that money go? If you haven't stopped the benefits, to stop those benefits takes a day. I can show you how to stop those benefits for the supposed 21 million people. That should have been stopped day one. Once Doge took over Social Security, and the new acting commissioner of Social Security is a Doge guy, he should have stopped all those benefits day one. Why weren't they stopped if those dead people actually existed? Well, because they don't exist. And if they do exist, then you've got a new Attorney General, Pam Bondi. Where are the arrests of all those 21 million people that have been receiving those benefits illegally, fraudulently? No arrests. The Doge website has not been updated to say, hey, we found $400 billion. And so, yeah, it was all a false story. Go figure. And this is what politicians on both sides have been doing for decades to trick us, to shut us up. So the clock is run out. So the cuts are imminent. And when the cuts are, months away, then we'll just surrender and say, okay, fine, do whatever you want to do. And what they want to do is give it over to the buddies on Wall Street. So this is the plan, and it's working perfectly for them. My husband's 75 on hospice. Wow. Retired at 63. I'm 65. If I work until I'm 70, my Social Security benefit won't be as high as his. Will I get 100% of his benefit at 65 when he passes? Wise to file now for me. So yeah, you can file for benefits on your own record if you need the money, coming in and stuff. And then if you, it really, so he retired at 63. So he retired early. So it gets a little complicated because he started at 63. So if you start your benefits, if you're your full retirement age, when you start those surviving spouse benefits, then you'll get 100% of his benefit. It'll be a reduced amount, but it'll be 100%. And remember, it gets even more complicated because survivor benefits, the full retirement age is a few months difference. But just kind of figure, kind of as a general thing, that if you are close to your full retirement age, you'll basically get his check, what he was receiving when he passed, including all the COLA and stuff. That's a rough estimate, but there's a lot more details in there because there's a lot of moving parts. I turned full retirement 66 and 8 months. Need to know how to file to do it right. Number one, check your earnings record. Go into socialsecurity.gov. Set up a My Social Security account. Check your earnings record. Make sure everything is correct, because that's how they determine, how much you're going to get is based on your high 35 years of earnings. And if you're 66 and 8 months, so you've already probably filed for Medicare at 65, possibly. If you did, then you've already done the difficult part, setting up a claim and everything like that. So to turn the money on is pretty easy. If you are waiting till 66 and 8 months because you're still working, remember, the year you turn your full retirement age, the work limitations are a lot more or less. The year you turn your full retirement age for this year, it's $62,160. The months under your full retirement age, you can make $62,160. Anything over that, Social Security holds back $1 for every $3 you go over. Once you hit your full retirement age, you can make $1 billion a month, and it doesn't matter anymore. So, waiting for first Social Security payment next month, but was told to sign up 8. As I still have medical coverage through my husband's work. Do I need to sign up for Part B now? No. If you're going to get signed up for Part A. That's free, zero premium. Not free, but zero premium. And if you have health insurance through yours or your spouse's current work, and that employer health plan has 20 or more employees, then no, you do not need to sign up for Part B. Don't waste the $185 a month. Then just keep on keeping on. Once you stop work, or your husband stops work and stops receiving health insurance from current employment, then that's where that 8-month thing kicks in. It's a special enrollment period. 8 months from when you lose your current health plan, you have to sign up for Part B, and there's no penalties. So you can do that at 75, 85, whatever the case may be. Let's see. Sorry for the second question. Please consider having Alex Lawson of Social Security Works on your show. Yeah, he is. He's pretty awesome. He appears quite often in Thomas Hartman and appears in front of Congress and stuff like that. So, what about SSI? Is it still safe for how long? I paid into it for 35 years. No, you paid into it. You paid taxes. SSI is the welfare-based benefit. It's not part of the trust fund. We don't pay into SSI. We do through taxes. It just comes out of the general tax revenue. SSI does. But I'm sure you're asking about Social Security, retirement disability. No, it's not okay. It's, as I showed, it's the trust fund is running out because of various reasons. The biggest reason is if you make over $176,100, you no longer pay Social Security FICA tax. If you make under that, you pay FICA taxes on every dollar you make. But more money is going to the top, and therefore those over $176,000 or so, they don't pay FICA tax anymore. So less is going into Social Security. So we have this much coming in, and every year we got that much going out. And what's covering the difference? The trust fund. We're pulling money out of the trust fund. This year, probably about $100, $110, $120 billion going to be pulled out of the trust fund. Next year, another $100 billion or so. And then guess what? The savings, the trust fund has disappeared, and it's looking to be disappeared, spend down in 2031, 2033, 2034. Depends on what happens over the next few years. So reach out to your politicians and say, hey, what are you doing to fix it? So Medicare for all. Yeah. Let me see. I will not cut one penny from Social Security or Medicare, Trump said during his campaign, vowing to end taxation of the benefits. Hello, all you maggots. Wise up. Okay. Um, yeah, it's the cutting staffing is cutting benefits. Because how do you get your benefits? You contact Social Security and you do your thing. But if there's nobody there to help you get your benefits, then there's delays and mistakes, and you don't get what you're entitled to, what you paid for. So that's cutting benefits right now. And but it's just a tricky way to cut benefits is to block you from getting your benefits. So smash the cap is what it's called. 176,000. Everybody should pay the same. I just received an email from Social Security today stating they probably owed me money. They stated people under the Social Security Fairness Act will start getting their retroactive payment during February. Yep, I did a video on that yesterday. So definitely consult a lawyer if you're denied. Yeah. If predominantly for disability, if you're denied, again, I recommend after the second time a lawyer, but you can get a lawyer anytime you want. And they will work on a contingency fee that if you're approved, they will get 25% or up to $9,200. But most other stuff, lawyers, if you're denied for survivor benefits or SSI or, because of, resources or income or something, then yeah, lawyers. Well, a lawyer will do anything if you pay them a whole bunch of money. So I guess there's that. All right. Let's see. I hold Dr. Ed parties to learn from you. Thank you. Wow. Yeah. I wonder, do you have a drinking game where I say 100%? Every time I say 100%, you take a drink or something. And yeah. I got to stop with some of the repeating things I say all the time. If you haven't done so already, don't forget to hit the like. Yes, thumbs up button. That's how the information gets out there. So maybe that's the part of the drinking game. Please hit like. No, I don't say it that often, do I? Way bid Social Security take $185 out of my check. I went from 15 to 13, and all I got today was 1041, and I didn't know nothing about it. So sounds as though you might have just turned 65, and now you have to pay for Medicare Part B. And maybe they took out the first 3 months or so, or 2 months or 3 months or whatever the case may be. There's a way to get around that is you can call Medicaid if you're struggling, if that $185 is, really going to, put a kind of a hamper on your life, reach out to Medicaid, Department of Social Services, Department of Welfare, and apply for Medicaid, and they just might be able to pay for your Part B premium. Another way is called the Medicare. It's called the Medicare Savings Program, and then you'll have Medicare and Medicaid, and then you can get one of those dual eligible plans and see if there's any extra benefits there for you. There's another way if you're struggling to pay that $185. If you don't get approved for Medicaid, then there's called these Medicare Advantage Part B give back, and they pay for part of your Part B premium, $50, $100, $185, depending on where you're at in the country. So, but watch out for those because, insurance companies aren't dumb. They're not going to pay, they're not going to pay $185 every month for your Part B premium and not take it out of someplace else. So if you're healthy and stuff, then, it's good. But if you compare a Part B give back with a regular Medicare Advantage plan, the Part B give back, let's say, they give you $185, but they charge you $300 a night for hospital. This one, you don't get any money back, but it's only $100 a night for hospital. So you really have to check it out. Let's see. I have a Medicare Part A and B, 80%, and a company 20% is as good. Yeah. So you have a Medicare a supplement plan. And so you're, the Medicare supplement plan covers the other 20% plus the deductibles and all the rest of it. So it really depends on whether you have a G or an N, but it sounds like you have a Medicare supplement plan. So keep it as long as humanly possible. I don't want the Part B of Medicare next year. What will happen? I hope not to use prescription only vitamin. Okay, so you're talking about Part D, prescription drug plan. When you sign up for a Medicare Advantage plan, most of those have the Part D plan, the prescription drug plan, embedded in them, so you don't have to sign up for Part D separately. If you get a Medicare supplement plan, NG, whatever, you do have to sign up for a Medicare a Part D plan separately. And a lot of people miss that because they say, well, I don't take drugs anyway. Okay, that's fine. But if in the future you do, 5 years, 10 years down the line, you're going to be penalized because you didn't sign up for Part D when you were supposed to. 1% for every month you didn't. So I see a lot of people making that mistake, and they're like, "Oh yeah, I don't take drugs, so I don't need it." And then 5 years later, guess what? They have to take a prescription for something, and yeah, so you just find the prescription drug plan that is the very cheapest, since you're not going to take it any. Some of them out there. Last year there was some out there for like $5 or $10 or So you just get the cheapest possible one to avoid the penalties in the future. So. But if you plan on never taking prescription drugs ever, 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 and you've got that crystal ball, then you're never penalized because you never sign up for it. So, can you go back to Medicare and a supplement plan G if you have been on an Advantage plan for the past 2 years? Yeah, if you're health underwriting, if you pass health underwriting, there is a trial period that you can do with Medicare Advantage, and supplements you can kind of go back and forth with a year. And there's birthday rules that some states have. So reach out to your broker or agent, whoever helped you out, or reach out to chapter, and they can tell you whether you're able to go back to that and based on your particular state. All right, we are over an hour and I've run out of time again. Mary became a silver member. Thank you very much for the support. Me and my son appreciate it. He is behind the scenes making everything work, making sure I don't make too much of a fool of myself, which he needs to work harder, but it is what it is. All right. I'll be back again tomorrow, and I'm going to have the guy that wrote the book on, I guess, Medicare. He actually wrote a book on Medicare. He's going to be joining me tomorrow from chapter and answering all your questions specific to all of that. And so we'll talk about that tomorrow. Y'all have an awesome night. Make sure you take care of each other, and we'll see you then.